what happened yesterday is that like the samples melted.
Okay, good afternoon, everyone. Welcome, and yes, really nice to see so many people online. We have a few more people joining, so I'm just going to give it another minute. This is a live webinar. However, you do have the opportunity to join in discussion and share later. So please keep your microphone muted. We will potentially open up for questions if we have enough time at the end. So I'm noticing lots of people joining. I'm going to give it one more minute to do so before I start introductions. Just checking that. It seems quite good. Okay. I'm going to officially start as we are 2 minutes into our time. Welcome everyone today. My name is Adele Stewart-Lord. I'm a professor in health workforce at London South Bank University. But the webinar today is offered within the umbrella of the NHR Insight South London programme. So today we have some speakers to talk about their career in genomics. And I'm going to move on to the next slide. So before we go on to what we are covering today, I'd just like to introduce, as I've done myself, I'd like to introduce Dr. Tuti Boyse, who's the Director of Nursing and Midwifery at South East Genomic Medicine Service Alliance, and I'm going to allow her to actually speak a little bit more about herself when she starts her presentation. So Tuti, thank you a lot for joining us today and for presenting, putting your presentation together and being willing to do so. We also have another colleague, Rishu, who will be joining us slightly later as she's doing the second part of the webinar today. So a big warm welcome to both of you. Next slide, thanks. Before we move on to the actual webinar, it is my responsibility as co-director of the Insight scheme to just again raise awareness of the scheme. I'm sure many of you on the call are part of our group already, either through the steering group or program group or through our networking. But just again to make you aware that NHR Insight is to inspire students and early career individuals into research careers. It's spans across a partnership of 4 universities, 7 NHS trusts, and 4 NHR organisations in South London. And I'd just like to do a special welcome for anyone from our partner organisations here today again. So the idea behind the NHR's Insight scheme is to provide fully funded scholarly master's courses for individuals in their 5 years post registration, and then also to offer a wide range of research engagement activities, of which one is today, the webinar that we're offering today. Please have a look at our website. Go to the next slide. Thank you, Jana. And you will see that our website actually provides detailed information on both our scholarships and also our research engagement activities. So just making you aware at the moment that we have 19 different master's scholarships available or programs available for people to apply for a scholarship. There is a code there, a QR code, if you wanted to use that as well. And just a short summary of it actually covering tuition fees and stipend for individuals. Our program is currently open for recruitment and the closing date is the 26th of February. So please take account of that. There are 2 webinars running. So there's on the 15th of January a webinar for prospective candidates and their managers. And then also on the 29th of January, there is a how to write a successful Insight application. So if you are interested or if you know of anyone that's interested, please share this information with them. Thank you. Next slide. So to make you aware, as I said, this webinar is part of a greater mix of research engagement activities that we offer. So for example, we are having a Discover Research event. This is a live face-to-face event that will be taking place on the 19th of March at St George's Hospital. We also have a number of podcasts available. Links to these are available on our website. Please have a listen to these. They are very insightful in terms of helping people understand clinical academic career pathways. We have some bite-sized engaging and research webinar series that are offered through the Cater office at King's. And we also always welcome participation in our student and early career advisory panel. So we have a number of students and early registrants that are part of our advisory panel, and they advise on all activities and information in relation to insight. So we welcome engagement from all individuals who think they could make a valuable contribution. Again, may I remind everyone to keep their microphones on mute until we potentially open up for questions. Also, just to say this webinar is being recorded. The slides for the webinar will be shared in a PDF format to those who have registered for the event and will be available after the event. These will be sent to you directly. I'm going to move on to the next slide and then officially introduce our colleague Tuti. And again, a big thanks for doing the webinar for us today. We look forward to hearing all about your work. Thank you.
Thanks so much, Adele, and thank you to the Insight program for inviting me to speak. And I do hope that many of you will be encouraged to ride the wave of genomics to develop your clinical academic career. And in fact, this Insight program is an ideal way to start that sort of initial sort of riding that wave. So I'm Tuti Bueza. I'm Director for Nursing and Midwifery at the Southeast Genomic Medicine Service Alliance. I'm also an NIHR senior clinical practitioner researcher based at the nursing faculty at King's College London. Next slide, please. So just to for our discussions today, hopefully we'll be able to familiarize you with the genomic healthcare policy and infrastructure currently in England, discuss opportunities for research, provide resources for education and training, and share a little bit of a snapshot of our clinical academic career journey, which is mine. Okay, next slide, please. So just to set the scene, the government is completely behind us in terms of genomics, because if you read the new 10-year strategy, or the 10-year health plan, genomics is mentioned in there about 100 times. So this is a good time to do your research, to inform policy and be part of this 10-year health plan. And I'm sorry if this presentation is very much focused on nursing and midwifery because I am a nurse, but I think this a lot of the concepts here apply to all health professionals. So in terms of nurses and midwives, the genomics proficiencies has been there since 2018 in terms of our NMC proficiency standards, but the sort of the details of that is a bit woolly, but we are obliged to be competent in genomics as part of our role. So next slide, please. So to partner with the 10-year plan, we've got a genomic strategy for England, accelerating genomic medicine in the NHS. So the kind of key themes around there is embedding genomics across the NHS and delivering equitable genomic testing for improved outcomes in rare diseases, common diseases, and in cancer, and enabling genomics to be the forefront of data and digital revolution, and evolving the service driven by cutting edge science research and innovation. So this is where you would all come in as well, not just as health professionals practicing in genomics, but to really push the boundaries of your practice to get the genomics innovation and then translate that into practice. So next slide, please. So I'm part of the Genomic Medicine Service Alliance. There's 7 of us in England, and we work with healthcare professionals or the clinicians, the genomics laboratory labs, academia, to really support the systematic embedding of genomics into routine clinical care, facilitate rapid adoption of scientific advances, and have collaborative partnerships working across disciplines and geographies. And we are there sort of, you see on your bottom right, and I think Dominic is here, who is also the lead nurse for working with me in the Southeast. But there's contact details if you need to contact us as well in other regions. We've got the National Genomic Test Directory, and this is where all the tests, genomic tests in England are kind of written down. These are funded, and this will tell you the clinical eligibility, the technology by which the test is performed, and all these tests are funded. So there is, hopefully that removes the economic barrier to testing. And as you can see, it changed the way we practice as health professionals, because there will be more genomic tests available. Next slide. So therefore, we really do need to be genomic literate, and there are many resources that you can access to get ahead in genomics. So we've got GeNotes, which is an in-clinic a resource, so to help you with the patient in front of you, and in terms of their genomic sort of healthcare. There's the clinical pathway initiatives that will help you get from A to B in terms of genomic tests and the kind of competencies and resources you can use to get into that competency to be able to facilitate a genomic test and up to relaying results. Now, these are, go back one, Yana, please. And then the resources for genomics for nurses and midwives. Now, but actually, this is for all health professionals as well. And part of this, so you can have bite-sized genomics sort of information from 5-minute sort of snapshots to, again, a full-on master's in genomic medicine, which is part of the Insight program. So that might be something of interest to everybody. Next slide, please. And then we have a network of nurses and midwives who are interested in genomics, and we're trying to build an ambassador network to promote genomics across trusts. We also have recently formed a research forum for nurses and midwives who are interested in genomics. So please let us know if you're interested in any of those, because this might help you hash out some of the ideas you might have as a project once you're sort of in your MSCs. Next slide, please. Now, there's a lot of research ongoing in genomics, and I think every news item for the day involves some kind of genomic discovery. But I just wanted to talk about a landmark study currently ongoing, which is the Generation study. And this is aiming to sequence the genome of 100,000 healthy newborns. So first of all, the purpose of this to evaluate the utility and feasibility of screening newborns with whole genome sequencing for clinically actionable diseases in infancy, and number two, to understand how babies' genomic data could be used for discovery research. And then the third is obviously over time, this would be a repository or a reference for that individual as they grow, and how that genome will be used for sort of a lifetime healthcare. So that recruitment is ongoing there, and in many of the trusts that are members of the Insight program. You might be familiar with this. And the next slide. So when we have these genomic research, particularly those sponsored or hosted by Genomics England, it does go to the National Genomics Research Library. So if you can see here in this sort of evolving sort of schematic, so let's, you have the DNA sequencing, and then you have in the middle there the sort of Genomics England, which is where the repository is of that NGRL. Now the data there is de-identified, and then researchers are then given access to that for various types of research. And this could be you. This could be you looking at the NGRL and making those genomic discoveries. And then moving on to therapeutic developments in both cancer, common and rare diseases, diagnostic discoveries, new conditions, new syndromes that we've never known about, and then that plugs back into clinical care, either to that individual person who's participated in the research study, or on a population level, or how pathways may change as a result of the discoveries there. So really, actually, again, this is there for you to use if you choose to focus your research on genomics. And it says doctor there, but actually anybody with a reasonable and sensible research proposal will be able to access the Genomics Research Library. There's just an approval process, and most of the supervisors in the Masters in Genomics will know how to do this. Next slide, please. Now, I just wanted to talk to you about the impacts of genomics research in inherited cardiac conditions, which is my specialty, which kind of leads on to sort of my own personal journey. So, you know, we've had this genomic test directory, so we're now seeing more tests being mainstream. So, genetic test traditionally was performed in clinical genetics department, and now they're now in the medical specialties like in cardiovascular. So that's changing the way we practice and the pathways of care for our patients. The second is pharmacogenomics. So CYP2C19 in particular is becoming much more important in cardiovascular. So this helps you adjust doses of medications according to a person's CYP2C19 profile, which is at the moment very important for drugs like mavacamten in hypertrophic cardiomyopathy and also in anti-platelet medications. Then, of course, we've got some new treatments. I mentioned hypertrophic cardiomyopathy, also in amyloidosis. These are heart muscle problems. Before, we used to only treat symptoms, heart failure, arrhythmias, etc. But now we have disease-modifying treatments to really reverse or correct the issues that we have in these conditions. And gene therapies are at the moment in the research realm in these types of conditions. Then phenotype genotype correlation. So the more research, the more sort of our data sets become richer. We're now learning more about our patients in terms of if they've got a lamin AC pathogenic variant or mutation. We know that they not only could have the heart problem in terms of a dilated cardiomyopathy, but they're very high risk for dangerous heart rhythm conditions. So we will then make sure that they are worked up properly to see if they need an internal defibrillator. But also some patients, depending on where the pathogenic variants lie in the gene for lamin AC, then it might be that they'll have a very severe neuromuscular phenotype, which means that they will have a lot of, they may need ventilation, they may need more aids for mobility earlier on in life. So it just helps us provide that sort of targeted or personalized care to these patients. And in the next slide. So here I've got sort of my own clinical academic career and how I kind of used the platform of genomics to to go from my bachelor's to my postdoctoral. So I'm an internationally educated nurse, and I started out as a staff nurse, where most of you might have or just started out with doing evidence-based practice, making sure your practice is evidence-based, and then doing a bit of audit. And then I became a specialist nurse in cardiovascular, in cardiac genetics, where I got more exposed to genomics and also the research projects there. And so I was able to, as part of my master's in advanced practice, I did a Cochrane review on the cardiac care for patients with Duchenne muscular dystrophy and Becker muscular dystrophy. We did a lot of, I was part of research delivery and recruiting for the 100K Genomes project, which preceded the Newborn Genomes project. So that actually formed the basis of a lot of the policy that we have now. I took part in developing a hypertrophic cardiomyopathy risk calculator, which it's 15 years old, but it's still the most effective way of determining whether your patient needs a defibrillator or not, in terms of if somebody has hypertrophic cardiomyopathy. And that is slightly, it's going to get better because we have more genomics knowledge now around those patients. I also did a PG certificate in genetic healthcare, and I think I focused there more on the pathway development in inherited cardiac conditions genetic testing. So because of that exposure, that really inspired me to take on some kind of higher learning, higher training in research. I looked at the gaps in our services. That there was a lot of we did the best we could in terms of medical care, and the patients were safe and getting through. But what was missing was their psychological support. What did they need? And because they were clamoring for it, and yet, we didn't know what specific type they needed, because you know traditional, like things like cognitive behavior therapy wasn't really the some of that didn't suit our types of patients. So I applied for a doctoral fellowship, and I was successful in getting an award from the NIHR. And so I looked at the psychological support needed for patients with a new diagnosis, or a person who's a carrier for inherited cardiac conditions. And some of the outputs of that was like, patients just needed some care closer to home, because they couldn't get that immediate care sometimes when they lived more peripherally to our sort of tertiary center. And that led to a hub and spoke model, and that was funded through the British Heart Foundation, which again, I was a lead applicant. And then now that is now the platform, really, which we will start doing our mainstreaming, because we managed to put together our communities with some local expertise locally in the region. And I applied to do the NIH 70 at 70 leadership program, which then supported me to not further my research, but further my capacity to support research. And so I became a director for NMAP, sort of increasing capability and capacity at St. Bartholomew's Hospital. And I was extremely honoured when CardioMap the UK, which is a patient organisation, also invited me to be a trustee, because I think that really kind of really sort of underlined my role in patient and public involvement, which I did a lot in my doctoral work. And so, COVID came and everything, and I was placed in a research delivery role there. And so, still kind of using my skills, we delivered the cardiac COVID study and the COVID surge program, which I think one of the most cited papers that I ever sort of participated in, because it really changed the way surgery was done during COVID time. So that is a little bit of a segue into out of genomics, but I think that still, keeps developing your my sort of research skills. And then I applied for a small Burdett grant there, which then helped look after the well-being actually of nurses who were inherited cardiac conditions nurses, because of the situation and how they provided care to patients during COVID. So when I all this work put me in a position to apply for this job as director of nursing and midwifery for genomics. So it's been, all this training has put me in good stead to be able to lead a lot of the regional, even some of the national work around genomics. But also then I realized, that I wanted to develop as well, still as a clinical academic, and that's where the postdoctoral stage came in, where I applied and was awarded an NIHR Senior Clinical Practitioner Researcher Award. So here I'm expanding sort of my building on from my PhD, which was mostly focused on adults, but now to look into inherited cardiac conditions care in the pediatric setting, but then also looking at education and knowledge of genomics of our healthcare professionals. So we've still managed to get quite a few other things there. A grant from Health Education England to support genetic counseling skills development, and also a monogenic diabetes project. And then we have a current grant for Burdett, from Burdett Nursing, to deliver an education package for inherited cardiac conditions. So that Cochrane review that I started when I was a CNS, we are currently updating that review. So hopefully there are more improvements now, not just beta blockers, but there's actually now gene therapies for Duchenne muscular dystrophy that supports cardiac care as well. And then, of course, moving on to my ability to grow and supervise the next generation of researchers, and starting off with PhD supervision. So, it's been I'm still, I consider myself still a very sort of early researcher. So I'm new to clinical academics, but I'm very keen to develop the next generation. I hope this is something that you'll take up. So Jana, there's some pictures as part of this. So these are my other sort of activities. So I just really, encourage you all to get involved, and be curious, because there's so many opportunities there. It's yours for the taking. So I consider my sort of my MSc as that sort of pebble in the water, sort of kind of uh, that type of wave. It's not quite a wave, it's just a ripple. And then when I had my doctoral fellowship, that's the wave that really got me more knowledgeable into my expertise in inherited cardiac conditions care, but also my gave me some meaty research training, and really put me in a good position to inform policy with the research that we're producing. And I think there's one more picture there that will come up. Yeah. And then this period, because everything is coming together in terms of sort of government policy, research funding available to all healthcare professionals at all levels, I consider this as a tsunami, not in a bad way, not in a destructive way, but hopefully a very sort of positive way in which that there are opportunities for everyone, and the Insight program is one of that. And in the next slide, um, I just wanted to emphasize some of the research opportunities in genomics, which I have taken advantages of all, and I hope you do too. So, so this says nursing, but this can be for any health professional. So, how do we educate our next generation of nurses now in terms of, in genomics? What other, because I don't think the traditional curriculum washes anymore. So, we need to prepare um, the undergraduates, but also postgraduates and those already in practice, what is happening to education around genomics, and how are we delivering that? What is the best way to do that? What about research delivery? Genomics has with it a lot of these ethical sort of attachments, and also sort of confidentiality, data sharing, etc. So are we doing research delivery well? What is the best practice for that? Are we including diverse populations? Because in genomics, if everything is based on a white Caucasian male or whatever population, that won't work. You can't deliver personalized medicine in sort of in that way. And what about the psychological impact and patient and family outcomes? Because we are introducing something new to our clinical pathways. How are patients now kind of reacting to that additional sort of information and implications for their family? And how are they changing their behavior as a result of, new genomic findings? And then in clinical practice and communication, how are we as health professionals improving our pathways, communicating genomic tests, consenting people, and that goes not just for research, but also in terms of clinical practice. Um, you know, uh, what's the best evidence for that, and how should we go about doing that? Big data, this is not just the realm of bioinformaticians. All of us as healthcare professionals, can do, research on big data, and particularly important because we can ask the right questions. So we might be able to get somebody to support us in generating the data or analyzing the data, but the questions will come from us because of what is relevant to our patients and our population. And then, of course, I mentioned equity as well, making sure that we have we design our research to be as inclusive as possible, and also the programs that we have for encouraging people to get involved in research. Are we also diverse ourselves as a group of researchers? So just a plug there for an article we published, but this applies to all health professionals, but just gives examples for nurses. And then the next slide. Think So just to emphasize, research opportunities comes in ripples, and this, the Insight program just might be that kind of dipping your toe in research, starting out early in your career, so you can use your research training very much longer to the lifetime of your career. So I think it's important, to start there. And the next picture, I said, waves. Make sure, when once that ripple starts, you ride that wave, that sort of fair wind that gets you from A to B, and really support, substantive research. And then the next slide is, that tsunami. Don't be afraid of it, and take advantage of it, and try and, suit it to your purpose as well. So you will find something there for you, and something that you can build upon, particularly in genomics, because, it's a very, I would say, fundable and very worthwhile sort of research topic at the moment. So take a plunge. And the next picture, it's not all rosy. You might get some shocks or disappointments along the way. I certainly, have had my own challenge. So, it's not completely sort of challenge free, but in the next picture, you can see that there's many of us here, the Insight program, people like myself, people in the GMSs, people already sort of a bit more senior in terms of their clinical academic career, who will be so willing and so supportive of you. So, don't hesitate to take the start your research career early on. I think I've got a last slide there. Yes, I just wanted to thank the people who have been very supportive of my own research journey, in terms of infrastructure, supervision, and all the patients who've been part of this research journey. And I think the next one is just just our contact details. And if you want to get involved, you've got some topics here that you want to develop for your application. Please, just don't hesitate to contact us. Thank you.
Tuti, thank you for a wonderful and very concise presentation. It's a very interesting and timely topic area. As you say, a lot of work and attention is now given to this area within this field. So thank you for sharing your insights, and congratulations on your wonderful career journey and trajectory. It is an inspiration to all of us. I think it's lovely to see how you came from your first research idea and how that has grown into some wonderful funding opportunities, like you say, riding that wave to get to that success. I think you're the first person that's actually associated tsunami with something positive, but we did like the pictures that you presented to really emphasize or visualize your journey. So thank you for sharing that. And yeah, I personally wish you all the best with a future career. We look forward to reading more outputs and in this interesting area. I just want to check if our next speaker is, because we might leave questions right to the end. I'm assuming, Tuti, you will be staying to the end, of course. So is Risha with us? Just checking if she's here. I can't see her online, so please feel free to.
Hiya,
Oh,
can you hear
you're
me?
there. Okay. I would like
Yeah,
to
hi, sorry,
introduce you. Thank you. I would like to
turn my
introduce Risha Varma. She is one of our actual Insight Fellows or Scholarship Awarders, and she is going to join talking around her student perspective and getting started in genomics healthcare research. So, Risha, thank you for joining us today as well, and do share your thoughts and ideas and your journey, and then we will take some questions towards the end if we have time. So thank you for joining us.
Yeah. Hi everyone, my name is Risha Verma. I'm one of, as Adele pointed out, genomic medicine students at City St. George's. I'm doing this part-time over 2 years, and I'm just in my first year. And just as a background, I'm a dual registered adult and mental health nurse by background. Just the next slide. So I just wanted a slide just discussing why genomics in particular and why I chose this topic. So even before the NIHR Insight program, I had an interest in genomics. Just learning about it at uni, learning about it in placement areas, in particular learning about it at my GP placement. There was a lot of discussion around sort of genetic and epigenetic factors that are influencing people's both physical and mental health. That kind of started my interest in it. For instance, why is diabetes more prevalent in certain populations? I'm from an Indian background, so for me that was a huge area that I was focusing on. And also looking at how stress and trauma affect us in terms of our genes. That kind of got me started. One of the key books I read was The Body Keeps Score, which is recommended in a lot of the mental health nursing courses. I mean, just reading that book, there was, when I look back on it, there is some research that I do find a little bit more questionable, but I think it really sparked that idea of genomics and epigenetics in particular for me. Another thing that I really like learning about, until this day learn about in my course, is how genomics personalizes and makes care truly patient-centered. So this is an idea that all of us in the healthcare profession, we talk about a lot, and how we can really approach patient-centered care, and how the idea of one size fits all doesn't always work. But I think with genomics, what I realized how specific you can get, and how individual a person is. So just because one medication is approved for a condition does not mean that every individual is going to react to that medication the same way. It's going to work the same way for them, and that it might be just maybe a gene, or maybe the being expressed that makes that individual different. And I think by harnessing genomics, we can kind of fine-tune the kind of treatments that people who it better suits. So I think that's what I really particularly like about genomics. And I just like that at the heart of it, it is the patient, and we are seeing them as a full person. And why I chose NIHR, since first year of my nursing course, I knew about National Institute of Health Research. I had always wanted a career in health research, and so I could see the sort of the skills that they can help you develop. And this scheme was quite helpful for me, because NIHR does have other funding options, but I found them a little bit intimidating, if I'm being honest, kind of coming in with your own master's or doctoral project. But I thought this scheme was really fantastic for me to do kind of like a bridging master's in a research area I'm interested in, and get that support and access to like sort of structured funding and training as well. So that's why I was really excited to apply for this. Sorry, next slide. And then I just wanted to say a little bit about my experience so far as well. Just being on the course, coming from the background that I'm coming from, I know a lot of people may be from varied allied professionals, but for genomics medicine, I did feel like there was quite a bit of a gap in knowledge. When I first started the course, I had to read a lot more. I was going down to the basics of learning what DNA is all over again. And I did use quite a lot of the resources that were available. So the Genomics Education England website and a lot of the textbooks that were offered by the course were really, really helpful and very accessible. I found the teaching very engaging, and I really wanted to highlight that, just not to say like as a point, but it definitely was very, very engaging. I like how, you know, the lecturers use different sort of ways of teaching. We do a lot of case study work as well, which I find really interesting. You know, if you've worked with patients before, it kind of grounds stories and kind of makes it relatable to you as well, of how genomics is applied in everyday clinical work. And the teachers have been very, very knowledgeable. And I think one key thing that really sticks out in this course in particular is they kind of treat you like almost like a colleague. Like when they're discussing cases with you, when they're discussing new theories, new literature that's out there, you know, it feels very inclusive. And one thing I would want to point out with genomic medicine, especially if it's quite different from what people have been covering in their courses, is you do learn how to learn. So some of our courses may have consisted a lot of like essay-based work, or maybe a lot of memorization, but with genomics, there's a lot of big concepts that you kind of have to relearn how you learn things, and try different ways of doing things. Like, for example, I didn't think I would be a visual learner. I thought, you know, when someone explains it to me, I get it. But in genomics in particular, I've been really appreciating like using diagrams, using graphs to kind of understand the concepts. So this is what my experience has been so far. And like I said, I'm only in my first year. So I think in my second year, when it's more research focused, there'll be more things to learn. But yeah, that's briefly what I wanted to say, what my experience has been like.
Thank you for sharing that with us, Risha. Much appreciated. And really interesting to note that we have fellows in specific areas as well, or specialist areas. So I'm going to open up for questions and answers. If you wouldn't mind putting up your hand, and then I will allow people to speak up. Any specific questions for either Risha or Tuti? I'm not seeing anything in the chat. Oh, there we go. Wendy. I have a question from Wendy. Please unmute yourself. Thank you, Wendy.
Oh, hello. Thank you both so much for sharing your really interesting journeys. I was just wondering how, as a working professional, how you fit in. I see that it's part-time, the program, but is it kind of like a blended learning with online as well as in person? Is it all in person? Do you need to be close to the university where it's delivered, or how does that work?
I'm assuming this question is for Rishi.
Yeah.
Okay,
Yeah.
thank you.
Thank you for your question. It is part-time, and I am working as a mental health nurse at the moment in an inpatient setting. In terms of the delivery of the course, it's one of the reasons why I chose this course versus the other masters that were available for NIHR, because what they do is it's a 9 to 5 Monday to Friday, or like 5 weekday teaching. So you're in teaching 9 to 5. Some of it would be online, some of it would be in person, and it's a mixture of lectures, workshops, and seminars. And because it's quite compressed, it's easy for me to take study days and sort of time off work. And then after about 6 to 8 weeks, you'd have an assignment that's due. And you can access like uni support. You can speak to your lecturers throughout that whole time, even after the teaching element has finished. But in the beginning, I did think it was quite dense, like 5 straight days of teaching. But once you kind of get into the rhythm of it, it's actually very useful, especially if you're balancing work, or I know lots of people have children and family to balance as well. So at least the in-person teaching element's quite succinct.
Thank you.
Thank you. I note there's some
that answers the question.
questions in the chat as well, so I'm just going to move to theirs. There was one, it says, I'm currently a MS mental health nursing student, and I'm curious to know whether genomic research remains a viable pathway for individuals without an adult nursing background. Is this an area I could still move into? So maybe Tuti, you want to comment on that if you feel able to?
Yeah, I mean, as you can see, Rish is now mental health nurse, so you're very, very much sort of, this is very much an option for you, Claire. But also that there is a lot of genomics in the mental health field. So, you don't even have to switch in any sort of kind of registers. As a mental health nurse, there's so many options. And I think that's one of the things we're trying to promote is how genomics applies to the various specialties, because I think people don't realize that it, it is like almost like the golden thread of healthcare now is genomics, and that will be very soon the backbone of the care as well. So uh, yeah, don't let that hold you back, Claire. I think it's actually an advantage.
Thank you. And there's some other positive comments in the chat as well. Please do read them. Carol has her hand up. Carol, do you want to unmute yourself and ask your question? Carol, are you with us? I know Carol's struggling to unmute herself. I'm just going to see if I can unmute Carol. No question from Carol. Okay, I'm going to move on. I see in the chat there's another question from Wendy. I'm wondering about how genomics may relate to children's mental health. I am a nurse working in children camps. Yes, any comments maybe on that from either our speakers?
Yeah, I think, genomics in children is actually more pertinent. As I just attended this conference where, if you see phenotypes in children, you get the pure phenotypes. So, if you've got a child who's got, like learning difficulty, intellectual disabilities, or, other sort of kind of, and other features, that's kind of like where you kind of start sometimes with having to do some genomic tests. So very for sure, in pediatric mental health, genomics is going to be very important. But also, the psychological aspect of that is also, how do children deal with, their own sort of genomic conditions or genetic syndromes that may have, and as they grow and cope with that. So that's another aspect of it that you can look at, and not purely from what's causing these sort of physical or problems. So I think there's a lot of scope there. I think
Yeah.
there was a question for Rishu, I think, around her research projects involved. Is it Roisin? Yeah, research project were you involved in during your master's and afterwards. So Rishu, do you want to answer that?
Yeah. Sorry, I was just typing up the comment to Roisin because I thought she maybe wanted it as a comment. But yeah, just really briefly, I did my master's in mental health nursing, so our projects were quite health focused. So my final year project was around parity of esteem and a quality improvement project on improving cardiovascular disease screening for people with mental health illness. And the way I kind of brought in genomics was mostly we were talking about like biological aging and the fact that people with mental health conditions, particularly schizophrenia, are at a higher risk for CVD. And yeah, so it's more of like a quality improvement project, but did a significant literature review around this.
Thank you, Rishan, and apologies I missed that first one. I think we have another question from Louis.
Hello, hi Tuti. Hello everybody. Just very quick question because just very quick question because I've been having some conversations with some band 5 and band 6 um nurses at the Evelina, children's nurses at the Evelina, who are really interested into having their first step into research. And I was trying to advertise the NIHR Insights program. Some of them are really interested about the role of genomics in cardiology, but then they have just some questions around that. Like, for example, they're very junior, they're more band 5, and then just started out on doing their band 6. They don't have any practical experience in clinical genomics from before. And their main anxiety is after the program, how are they going to sort of integrate what they've learned within the master's context into their clinical practice, trying to bring back that academic portion into what they do on their daily practices in the wards. What kind of advice would you be able to give them so I can kind of sell it properly to them as well?
Thank you, Louis. Thank you for promoting the programs. I think that the thing about getting additional research training, it just transforms you. You look at things in a different lens. So I think whether you go into your practice and think about probably, first step is looking at service improvement or doing a quality improvement project. Normally, that's how you start, sort of, you know, if you haven't done if through your research training, you can then then that will then generate more questions which you can build on in terms of what's, because you bring your, let's say you did a related project around cardiac, and so that you can bring that into your practice and then look to see what you can implement from the research that you did, or you look at sort of where the gaps are in terms of that topic. So I think it's around looking at your setting and what could be improved in terms of your patient care, or how or finding out certain sort of phenomena in patients that you might not have discovered it in that research. So to building on to that research. So I think you bring, you become a little bit of a nurse plus in that sense, because you bring your research lens back into practice. So you can either, pursue more quality improvement projects, or build on that research, pursue a PhD to then think about, addressing a gap in in your practice. And yeah, cardiac is a wide open space for so many things. So, there's something for everyone. And, we can always do one-to-ones if needed to support, going forward with your research ideas.
Thanks,
Thank
Tuti.
you.
I was actually planning to send them to your research cafe as well, but that's a
Yes,
different conversation.
I think, yes, there's one next week.
All right, thank you.
Thank you, Louis. Thank you, Tuti. I think Carol has put her question in the chat because she says her mic wasn't working. And she is also a very similar type of question. I'm currently doing an MSc leading research delivery from NHR, and I'm a pharmacy tech, but I'm not getting enough help with regards to getting started specifically to genomics. So any advice you can give on that, Tuti?
I think, Carol, which trust are you in? Does she?
She'll have to chat that because she's her
Yeah.
question.
Oh, okay. Yeah. So most in if you're in the member trusts of the Insight, just for that, for example, actually there's a lot of support and I guess in terms of nursing and midwifery. Even if you link in with that, we can signpost you to somebody who can help you get that first step. And I think this is
Yeah,
yes.
may I also recommend your AHP leads, because I know a lot of the pharmacy is now going through the AHP leads within the trust as well. So just connecting with them to find out where are the opportunities there.
Yes, yeah. And of course you've got the research delivery network, which has its own sort of infrastructure, and which you can also approach in terms of your ideas.
Okay. I'm
King's
just checking.
Cato.
Yeah, there you go. Of course, yes. And she was from SLAM, so she did mention that.
Okay.
So of course, yes.
Oh yes.
I
So
think there was a second question. Thank you, Carol. A second question from Samia. Amazing career journey. Oh yeah, and how to get your foot or navigate networking. So networking opportunities, and I think you have addressed quite a bit of that in Louis' as well. So if there's anything else you wanted to add to that.
yeah, I think a professional society. So whatever your profession is, normally, if you get engaged in them, they've got a research arm or research interest group. King's Clinical Academic Training Office is a great place. They do a lot of networking opportunities as well. So there's we're very fortunate in the institutions that we work in, that we have these forums. But sometimes the problem is not being able to see to get the information around that. So if you link in, I think that you'll always get the emails and opportunities to engage. Yeah.
Thank you for that. And of course you have offered as well, people can reach out to have some chats. So that's really helpful as well. Any other questions? Well, very timely, and it's allowed for some questions and discussions. So I'm going to say again a very big thank you to Tuti and Rishu for speaking to us today and introducing such a very important and timely topic as well. It has been really interesting to listening to both of you. We thank you for your preparation and your time in doing this under the Insight scheme. And just going to bring it to a closing. I don't think we had any slides to close, but just to say there's the link. Jana has put it in the link, the Cato link in the chat as well. And also just to remind you to have a look at our Insight website for any further resources or feedback. And Jana will be in touch with regarding to give us some feedback about our webinar, and be sending out the slides from the webinar as well. So a very big thanks both speakers today, and thank you everyone for attending. I hope it has been insightful and valuable. There's some nice comments in the chat there for you too, T and Risha. Thank you again for your time today. Much appreciated. Thank you, everyone.
Thank you.
Have a good day. Bye.
Bye.
Thank you. Bye.
Bye.